High blood pressure, medically known as hypertension, is one of the most underestimated yet deadly conditions affecting millions worldwide, and it earns its nickname the silent killer because it often shows no symptoms until it causes catastrophic damage, like heart attack, stroke, kidney failure, or vision loss. Understanding what it is, why it happens, and how to prevent or manage it is absolutely critical for everyone, whether you are young or old, because hypertension is no longer a problem of age. It is increasingly seen in people in their 20s and 30s due to modern lifestyle factors. But what exactly is high blood pressure? Simply put, it is when the force of your blood pushing against the walls of your arteries is consistently too high, and this constant pressure damages the delicate lining of your arteries, causing them to harden and narrow, a process called atherosclerosis, which forces your heart to work harder, gradually weakening it. The normal blood pressure range is around 120/80 millimeters of mercury, and anything consistently above 130/80 is considered elevated or high, with stage 1 hypertension. Between 130 to 139 systolic and 80 to 89 diastolic, and stage 2 being anything above 140/90, while a hypertensive crisis, a medical emergency, occurs when blood pressure spikes above 180/120. But here's the scary part. Most people with high blood pressure don't feel anything, no pain, no obvious warning signs. And that's why it silently damages organs over years until one day, a sudden event like a stroke or heart failure occurs. So what causes it? There are two main types: primary or essential hypertension, which develops gradually over many years due to genetic predisposition, poor lifestyle habits, obesity, high salt intake, lack of exercise, and chronic stress; and secondary hypertension, which is caused by another condition such as kidney disease, hormonal disorders like thyroid issues, sleep apnea, or certain medications like steroids or birth control pills. And there are risk factors you can't control, like age, family history, and ethnicity, but there are many you can, including reducing your salt intake, because too much sodium retains water and increases blood volume, quitting smoking, limiting alcohol, maintaining a healthy weight, staying active with at least 150 minutes of moderate exercise per week, managing stress through deep breathing, meditation, or yoga, and eating a diet rich in fruits, vegetables, whole grains, and foods high in potassium and magnesium, which help relax blood vessels. But let's not forget the hidden contributors. Stress hormones like cortisol and adrenaline can cause temporary spikes that, over time, damage arteries if stress is constant. Lack of sleep raises your risk, and even excessive caffeine can play a role in sensitive individuals. So how do you know if you have it? The only way is regular monitoring with a reliable blood pressure monitor at home or during checkups, because waiting for symptoms is dangerous. Those signs like headaches, dizziness, nosebleeds, or shortness of breath sometimes occur. They usually happen when it's severe. Untreated high blood pressure leads to what we call target organ damage. Your heart enlarges and weakens, leading to heart failure. Your arteries clog and stiffen, causing heart attacks and strokes. Your kidneys scar, leading to chronic kidney disease. Your eyes develop retinopathy, which can cause blindness, and even your brain suffers, as hypertension is one of the strongest risk factors for dementia. If diagnosed, treatment depends on the stage. Early stages can often be managed with lifestyle changes alone. But if blood pressure remains high, medications like ACE inhibitors, beta blockers, calcium channel blockers, and diuretics may be prescribed, sometimes in combination, and these drugs work in different ways to relax vessels, reduce blood volume, or slow heart rate. But adherence is key, because skipping medication can cause dangerous spikes. And here's another important point. Many people stop their medications when they feel better. But that is a major mistake, because hypertension is a chronic condition and stopping suddenly can lead to a rebound effect. So always consult your doctor before making changes. Some natural approaches like the DASH diet, which stands for dietary approaches to stop hypertension, can dramatically lower blood pressure by emphasizing whole, unprocessed foods, low sodium and high potassium, and limiting processed, packaged, and fried foods is crucial. But beyond numbers, think long-term. Blood pressure control is not a one-time fix but a lifelong commitment to protecting your heart, brain, and kidneys, and it starts with awareness, regular monitoring, and making small but consistent lifestyle improvements. So today, make a promise to yourself: check your blood pressure, reduce your salt, move your body, manage your stress, and if you need medication, take it as advised, because when it comes to high blood pressure, ignoring it can cost you your life, but controlling it can add years of healthy living, and that's something no pill or shortcut can replace.